Hello again, everyone. I'm Tina Otte, a registered nurse midwife and internationally certified childbirth educator. Today, I would like to talk to you about writing up a birth plan. What actually is a birth plan? Birth plan is a wish list. It is a way of you giving your caregivers now and in the future, for example, when you go into labor, what you would like from your birth experience. Now, remember, you can have a birth plan for a normal vaginal delivery, and you can also have a birth plan for a cesarean birth delivery. It doesn't mean that you can only have a birth plan if you're planning to have a vaginal birth. So that's something that you need to consider as well. I'm going to give you the 10 top tips that you should take into consideration when formulating your birth plan. Remember, it's not a list of commands or demands or you telling your caregiver or anybody how to do their job. It is merely giving people who are caring for you an idea of what you're hoping for from your birth experience. So the first thing, the birth plan develops as your pregnancy does. As you learn more and as you move through your pregnancy, you are going to have more questions as you move along the way. So start those lines of communication early. Don't be afraid to ask questions. Your caregivers expect them, and there's no question that is a stupid question. Ask for guidance from your childbirth educator, and you should be dealing with a childbirth educator as you enter into your third trimester. Write down your questions as you think of them. Even at night, if you're lying there and you've had a discussion in class perhaps, and something comes to mind, write it down. I'm a great believer in keeping pen and paper next to your bed so that you don't lose any thoughts during the night, which is going to stop you from sleeping. It's also important to think about your options and prioritize your options. Strike a good tone. Watch how you use your language. And I don't mean bad language. What I'm saying is be polite. Use the words prefer. I would prefer, not I want. I would prefer to have my baby put skin on my chest. It's immediately after birth, whether it's for Caesar or whether it's for vaginal birth, and especially if your baby's fine and you're fine and there's no emergency. Be brief. Nobody's going to read a 10-page birth plan. So be brief and be clear. It's important to be confident and to be specific. Don't be vague. But before you can do anything, you need to be informed. You need to know what your options are. You need to know what's kind of normal and perhaps what's not so normal. You don't want to ask for anything that is unreasonable. For example, can you go walking around the car park in your active phase of labor, for example? And these are things you might say, well, why not? These are things you'll learn in your childbirth class as to what is considered a reasonable request and what would perhaps not be or would be an unreasonable request. For example, don't have all the lights turned out when your doctor can't see if there's a problem going on, okay, in the birth room, but turning the lights lower might be an option that they would consider. It's important to make a few copies, especially when you're going into labor, so that your midwife has one, the midwife or the person looking after you, and your doctor has one, and there's one in the duty room, but you also need to have one. So remember, try and keep to that A4 one page, and if you like, you can break it up into first stage of labor. This is what I would prefer. Second stage of labor. This is what I would prefer. Third stage of labor. This is what I would prefer. And then, of course, there's the early postpartum, that golden hour. What's going to happen to you? What's going to happen to your baby? Where's your baby going to go? So these are things you need to know about before you can ask the questions. So be informed, very, very important. Make a list also of what you don't want to happen. For example, I would prefer my baby not to receive a supplementary feed without my permission. I would prefer my baby not to be given a dummy or pacifier without my permission. Please acknowledge me or keep me in the loop with whatever you're doing with your baby. Perhaps you don't want your baby to have a bath in hospital. Perhaps it's something you would like to do for the first time once you're at home. These are all things that you would learn about in your childbirth class, and I would encourage you to make that list, to ask questions, and then ask your childbirth educator for guidance in terms of your language and in terms of your requests. We make a plan for so many things in our life. This is one of those plans that are very, very important so that you don't have regrets afterwards, or you're not taken by surprise when something untoward or unexpected happens.